The pH scale moves over a course of 10 numbers or 10 numerals, 1 through or 0 through 10. Lower numbers on the pH scale mean that something is more acidic. Higher numbers on the pH scale indicate something that is more alkalotic in nature. Human pH sits on a slightly acidic side. Your body has two primary ways of managing pH problems. It's interesting for this reason. pH shifts obviously are very significant to the body, and even small shifts are very significant to the body. You can't sustain life with rapid pH changes, and you can't sustain life with way out of range pH changes. So your body has two systems to address this problem, but they are not equally good at the same thing. The two body systems that control pH or have a significant role in controlling pH are the respiratory system and the urinary system, the renal system. Each has a particularly strong side and a particularly weak side. On the respiratory side, the respiratory system is able to make quick changes to the body's pH. It's able to move pH relatively quickly. It can't move pH very much. It can make minor changes quickly. The renal system is the inverse. The renal system can make larger shifts, has the capability to make larger shifts, but it needs a little bit of time to do that because it needs the ability to concentrate urine and use that urine to correct the pH in the body. So let's think about a couple of the things that will get the body's pH off. One of the most common ones that you've probably seen is hyperventilation, hyperventilation syndrome. Whether that's secondary to an anxiety attack or some other function, we said already that the respiratory tract is responsible, or the respiratory system is responsible for making quick management of pH in the body. The reason that it does this is because carbonic acid is manipulated or modulated inside the respiratory system. Carbonic acid is used by the body to keep pH in range, and it is created by the waste products or the dumping of waste products from the body tissues into the lungs. So in other words, the more you exhale, the faster you breathe and the more you exhale, the more carbonic acid you're expelling with each respiration. Under normal rates of breathing, everything works perfectly. When you hyperventilate, you actually start to push the body towards an alkalotic state because you are essentially, or a patient is essentially, breathing off so much carbonic acid that the respiratory system can't use that carbonic acid to restore pH or keep pH balanced. Now, a couple of interesting things to remember in relation to that. First of all, people don't die of hyperventilation. It is why. Why can patients not simply hyperventilate themselves into a state where they become so alkalotic that they perish as a result? And the reason is that the body, and particularly the brain, it is an excellent job at monitoring pH and stopping the body from doing something that causes pH to get out of range. If you've ever seen someone in a true hyperventilation episode that continued to get worse and worse, in many cases, the end of that episode is that the patient passes out. They have a brief instance of syncope, and that's when the brain shuts everything down and says, whoa, 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 we're exhaling way too much. Our pH is getting out of range. It's getting out of range quickly. I'm going to put a stop to this whole thing, and we're going to just start over again. So people don't die of hyperventilation because the brain overrides conscious thought and says, we've got to correct this problem right now. Respiratory alkalosis is the term that's used to describe that phenomena. So the phenomena of breathing too much carbonic acid out, it is in an alkaline condition, would be respiratory alkalosis. Respiratory acidosis is obviously the inverse of that, but what do you think causes that? So if hyperventilation causes respiratory alkalosis, it would only make sense or stand to reason that respiratory acidosis would be caused by inadequate respiration. Inadequate respiration can occur for a couple different reasons. One of them is that we see sometimes now at a greater rate than before is the overdose, particularly an opiate overdose. Opiates decrease the respiratory drive, causing the respirations per minute to drop pretty significantly. I've seen respirations in opiate overdoses as low as 2 to 4 breaths a minute, and in some cases, patients survive those. But in any case, hypoventilation or not ventilating enough results in respiratory acidosis. Now, respiratory acidosis is a little bit different in terms of the ability to correct because the brain doesn't have the ability to leverage the passing out scenario or the syncope scenario quite the same way. And again, if we go back to the example of the opiate overdose, the brain isn't really capable of overriding the respiratory depression that's created by the opiate. Only medication can do that, the medication Narcan or naloxone in particular. So a respiratory acidosis is much more difficult for the body to correct than a respiratory alkalosis. When patients hypoventilate for whatever reason, whether it's related to illness or overdose or physical traumatic injury, increasing gas exchange is the only way to help resolve that problem. And the body's ability to conduct normal respiratory effort, normal breathing at a normal rate, is highly influential on the body's ability to maintain pH in the short term. So rapid changes to pH result when a patient is hyper or hypoventilating, and hypoventilating results in respiratory acidosis, and hyperventilating results in respiratory alkalosis.